counseling sessions and to help him to prevent withdrawal reactions. We may have to give him medicines to stabilize his sleep, to control the withdrawal reactions. This is a big job. Once it is done, then probably we may have to, third stage is to detoxify him. His whole brain and blood is filled with the alcohol, marijuana, or his brain circuit is altered permanently due to gambling or with the sexual behavior. The pleasure pattern, the reward is being permanently changed.
Yes.
So those things, the withdrawal reactions will be there. So detoxify him, make him more calm and quiet with the help of medicines, and a regular supportive counseling is required.
I'm Jitendra Singh, banker turned entrepreneur and author of the book Pep Hack Mastering the Art of Selling. I welcome you to read my story where I interview authors, speakers, coaches, celebrities, entrepreneurs and more. Today I have with me Dr. S.D. Singh. He is an accomplished psychiatrist, holds an MBBS degree from TVM Medical College and two prestigious post-graduation qualifications, that is DPM from Bombay University in 1974 and DPM from College of Physicians and Surgeons in 1980. He is a fellow of the International Society of Sex Education and Parenthood USA and a life fellow of an Indian Psychiatry Society, bringing over 50 years of psychiatric experience in Cochin, Kerala. Currently serving as a senior consultant psychiatrist at Sudheendra Medical Mission Hospital in Cochin. He has made significant contribution as a founder secretary of the Torture Prevention Center India Trust, founder director of Mukthi Deaddiction Center, and founder director of TVM Deaddiction Center in Cherthala. Additionally, he has been an active member of State Juvenile Board 1989 till 2004 and the first secretary of Indian Psychiatry Society Kerala State batch 1984. He has published 3 books including Alcohol Dependence, Memories of a Mental Health Professional, and A Life is a Textbook. And he has practiced in scientific presentations, and he has participated in scientific presentations at national and international forums. His areas of interest revolves around the treatment and prevention of addiction, adolescent mental health, and suicide prevention. So today he will be discussing his journey with us. So let us hear from him. Welcome, sir. The platform is open, and now over to you.
Thank you, sir. Thank you very much.
First thing I'd like to know from you is how did your past life has affected the person you wanted to be in your life and what you are? This means when we were young, so we have certain thoughts that we want to do something in life. So from that front, so what do you think?
About my personal matters, I was born in 1943. That means I am 80 years old now. Okay. I was a below average student in my school days and in my college days. And regarding my family, I had no restrictions from my parents. The motto of my parents, you earn money and you spend money. The only restriction they imposed was on spending money. So this was their motto. Otherwise, I was free to do whatever I like.
Right.
I never wanted or I never thought that I would become a doctor or a psychiatrist. But during my college days, I was interested in studies, and for my graduation, I could secure probably a 3rd rank in the Kerala University. So I could very easily walk into one of the leading medical colleges in Trivandrum. That's Trivandrum Government Medical College.
Yes.
But during my MBBS itself, I started realizing that the medicine is a science. It has very little physiology and very little psychology. I was in the lookout how to help the individuals who are really in a emotional distress. So I started thinking in that way from my third year of my MBBS, and that took me to the psychiatry part, and I went for my post-graduation, and then I was a consultant, junior consultant in Bombay Hospital for a very short time, and then I came to Cochin in 1974 and I started practicing here. Then now you can ask me whatever you feel like.
So you never thought of being a doctor, but you end up being a doctor, that too specialization into psychiatry.
That's right. I can tell you, helping the emotionally disturbed people.
Really wonderful, sir. So, sir, what are the things you are passionate about in your life, and what is the role of motivation and inspiration onto it?
I always look at people as a living organism, not as a machine or not as a creature itself. It's a human being, a living organism, and I realize that they have their own emotions. And my passion was to identify the people who are in emotional turbulence. It necessarily need not be a mental disease. It necessarily need not be a physiological part. It can be anything. So to help them, to support them, and to guide them, that was my passion. And if you ask me what is my inspiration, my own life experiences. As I told you, I had a life in the childhood and early adolescence with absolutely no restrictions. So I had my own life experiences, and that gave me inspiration. This is your area and you have to get specialized there. That is how I got into.
So you keep on exploring, like what would be the best thing you would like to do that way.
Yes.
Wonderful.
That's
sir.
right. Okay.
So now, sir, if I ask about your work and experiences, like how you started your career, like after completing your education, and what kind of like treatment or what all you do in your like role or as a doctor, as a psychiatrist?
Yeah, when I came back after my education, I had options before me to become a teacher, to become a practitioner, to do some community work and social work, and either in a government sector or in a private sector or as my own. So few things I decided I would not prefer to go into a government sector because there is a lot of restrictions. And
Right.
so I decided I'll go into a private sector. Then the second point which came to me was if I go become a teacher in medical colleges, again, that will be according to the syllabus. So I want to be out of that basket, and I thought I will do my private consultations and I'll be my own. I'll be my own. And my passion was to go to the community, identify the people who are in distress, in the emotional turbulences, maybe a mental disease or something else, and to help them and to guide them. That is the early part, and that is my motto in the life.
And apart from like personally practicing like your profession, you also work closely with NGOs as well. You support local people who are not able to like work well.
Yes, that's right.
Right, sir. Sir, yes, sir.
But get a label or an address in a metropolitan city like Cochin, I thought of taking an attachment with one of the major hospitals in Cochin. So to have an address and label and to associate, I am now the senior consultant of one of the major hospitals in Cochin, that is Sudheendra Medical Mission, where we have about 350 beds with all specialities and super specialities. So my outpatient clinic is mostly there, and also in the online and in my private consultation.
Right. That's really wonderful, sir. Now, if I ask you, sir, for next 5 to 10 years from now, so what is your vision, mission, or goal in life?
If you ask about the future in another 10 years, now I feel the whole medical part, the treatment and the sickness part is commercialized. Almost all private institutions in India, especially in Kerala, it's all commercialized. So the people who have difficulties and stress in their life, due to the financial reasons, many of them may not be able to reach a clinician, reach a specialist, or reach a hospital for an improvement or a way out.
too.
So even though I am attached to a private institution, I have my own online consultations and my private evening consultations. So there I do my practice, maybe free or maybe charging, but I am not very particular about the financial component of it. But I am very particular about the quality of the service I deliver to people.
Yes, sir. The most important thing you rightly pointed out, that most people don't think mental issues or mental health as a sickness or as a disease or a problem. So that is the
Yes.
reason, one more reason, that people don't go to doctors often.
Yes, I do agree. That is because of, a lot of belief systems are playing major role in our country. Belief systems including, the religious system and so many guidance systems are there.
Yes.
But every individual has got his own ideologies, his own likes and his own way of living. But these belief systems, including the religion, probably many individuals may not be fit into those things, and they are unable to rebel out and come out from it. As a human being, I believe that everyone has the Maslow's theory, ideally they want to have a comfortable life.
Yes.
Safe and comfortable life, and the essential things, they need to have their food, their clothing, shelter, and all these things. The second thing most people would aspire is to have comforts, may not be luxuries but comforts.
Correct.
But there comes the economy, and the people have got difficulty in earning, or even if they earn, they will be misguided, and a lot of things are there. So what I mean is the stigma about the mental illness and the way in which they have to come out of it, or the supporting system, is probably not very open or not very practical.
Right.
In my practice, what I uphold is the whole life, if you think, a sense of victory at the end of the life of any individual, he should feel that I have done something, for which he has to be mentally healthy first.
Yes.
More
Indeed.
than physical health, he has to be mentally healthy. And every individual who is growing should get a sort of emotional immunization. Probably this is the first time you may be hearing this word, emotional immunization. You might have heard about the immunization about typhoid, immunization for the tuberculosis and all. But
Right.
my belief system says that a emotional immunization is an essential component one has to get or gain during the late childhood or early adolescence. And if you have an emotional immunization, you will be above the stigma. And if you have any difficulty or you have any emotional stress or turbulence, you will be happy to share it with a mental health professional or whoever it may be, and you will be able to recover. And other things which I believe in my practice: knowledge, information, and hard work. These three things are the tools to lead a practical life. But those who are mentally sick or backward, or who is undergoing turbulence, may not be able to lead a practical life and attain the sense of victory at the end. And lastly, mostly when I interact with my patients and their relatives and in the community work, I tell especially the young children and adolescents and youngsters, time is the most precious thing in the world.
Right.
Because how do you spend your time? You can spend your time helping yourselves, helping others, and leading to a life which will fit into the community, which will be helpful for the others, which will be helpful for yourself. These are the mottos in which I work upon, and this is the way in which I do my practice. So, for example, any individual walking into my room, first of all, I think that he is not a mentally sick person. He is a person probably better in knowledge and in information and ability to work more than me. He is better than me. Then I start conversing with him. When I talk to such individuals, they give us informations. They talk about themselves. They expose themselves. So in that part, I go into the theoretical mental status examination, which we have learned in the college, and what we actually do in the practice. There is a core mental health assessment program. We look at the mood, attitude, the content of thought, the flow of thought, all these things, and the perceptions and the orientations and the insight and ability to judgment and all these things. Even though I make my own assessment, in between and at the end, definitely I interact with the individual again and repeatedly. Do you agree with me? So I talk to the relatives also. So my way of arriving at a diagnosis in the medical terminology is with the interaction and with the participation of the individuals who are coming to meet me. I say this as a participatory diagnosis. Probably this word may not be there in any medical textbooks.
Right.
The emotional immunization and the participatory diagnosis, the individual has to have a sense that there is something which he is lacking and he may need support. So there we start the relations, and we continue with whatever is the stressful or difficult life situations.
Sir, you have shared so many things that was really awesome, but the concept of emotional immunization and participatory diagnosis is one really an interesting thing. And I really found them interesting, and probably these are new terminologies which you have used, but would be in future, most probably most of the people would be using them on and often, because this is kind of a new concept which is coming up, like very important.
Yes.
and very realistic also, because you are engaging with the patient very closely and understanding their needs and requirements and guiding them with the process how to take the health in the right way. So that's really interesting one. So on to this further, sir. Now I'm coming back to you on personal thing and professional thing combined. So what are the most important life lessons or learnings you have from your personal and professional journey?
What I have learned is, see, the whole suffering of the humanity is not because of probably the financial matters. It is mainly because of poor mental health, or we can call it mental sickness, or mild to moderate or severe addictions, personality disorders, inability to manage with the disagreements of others. And these areas are the troubleshooting areas everywhere.
Yes.
Not only in the individual, in the family, or in a country where a group of people may have one opinion, the others may differ. So that the area of disagreement can further worsen, and that can lead to even calamities and things like that. And how that is going to affect the individual level. At the individual level and in the family level, that is troublesome. That is going to generate a lot of difficulties in the family.
True.
And fortunately, I have, from my practice and experience, I have realized that one of the areas where the whole humanity is going into the trouble because they are not aware how to enjoy the life, where to find the happiness, and how to identify the happiness.
Yes.
And a good percentage of people, for relaxation, comfort, and enjoying the life, they go for a beer or for a drink or a cigarette or a marijuana smoke or something like that. This is one of the big hazards in the life. This is one of the things which is damaging the humanity, the human relations, and the progress of humanity.
Yes.
So what I would suggest to the authorities is, unless or until the society have got higher level of mental health and able to interact with people in a harmonious way, they may not be able to lead a happy life. So, for example, alcohol dependence, suicide, and marital disharmony, all these are triggering a lot of issues in our country.
True.
And the pleasure seeking behavior of human beings, that is a basic thing. Everyone wants pleasure, comfort, happiness. But unfortunately, those pleasures and happiness cannot be purchased from a shop.
True.
Even if you have money, you can't purchase it. Where
Yes.
do you get it? But that is inside you. In every individual, that is inside you. And for that, you have to develop 7 factors I always tell people and in the community. First is we have to deliver, or we have to teach, or we have to train the youngsters to develop self-confidence. Self-confidence, one of the biggest pillars of a society with which they can progress further and enjoy the life. Second is whatever is your profession, you have to have the competency and uniqueness, because as I told you earlier, every individual is a unique creature, a living creature. So whatever profession you are, you may be a journalist, I may be a doctor, or somebody may be an engineer or a teacher. We have to have adequate competency. So the confidence, and second is gain competency in your area. And third factor which I advise the community in general, maybe perhaps healthy social relations.
Yes.
Prevent the segregations, groupisms and all. We are only one community, that is human beings.
True.
And to segregate, there are only 2 divisions, maybe male and female. So how do we have a healthy social relation? It is a big thing which politicians say one thing, or law says different lessons, and the religion may say different lessons. I am still working on it. I am not definitely sure how to bring up how to have a healthy social relations in our country or all over the world. The fourth factor, I would say, the brain structure which delivers the character of the individual. Character is always a gained quality. During adolescence, we learn so many things. We realize so many things, and thereby we develop our character. And so if you have a character which will deliver good interpersonal relations with other members in the society, you will feel happy and others will feel happy. And fifth quality, I would say, is to give contributions to the society. You may be a mason, or you may be a carpenter, or you may be a doctor, whoever it may be. You can do small contributions and services to the society as and when it is required. It is not called a charity. It is not giving a gift. When somebody is in distress, just smiling at him and inquiring itself is a concern. So, and the last but one is coping skills. When there are difficulties in life, or in the family, or in the society, as an individual, how do you cope up with others?
Yes.
How do we cope up with the other people? If your coping skills are below average, you can contaminate the whole society.
True.
And the last and the most important, there comes the mental health. How do you control your emotions? So with the emotional immunization, the adolescent has to be taught how to control your emotions, your anger, your depression, your anxiety, your curiosity. All these comes under your emotions. If you can have positive emotions, that can contribute to the society, and you can have a good relation with all members in the society. And if you have real competency in your area, wherever you are working, that can again contribute to the society. So 7 factors. One is confidence, second is competency, and third is positive social relations, and fourth is a good character, and fifth is a contribution, the willingness to contribute to the society, and the sixth is a coping skills, and seventh is a ability to control your own emotions. When you go through these 7 points, you realize that people with mental illness, people with low mental health levels, people who are addicted to chemicals, their ability to cope up with the society is considerably less.
Correct. All the factors like persistently would be less.
Yes, if the whole society goes into a turbulent state, the interpersonal relations will be poor, our productivity will be poor, our progress will be slow, we may not be able to come out with creative and constructive things in our society, in our country, even in our home. So, prevention of mental illness, prevention of addictions, prevention of what you call the emotional immunization. I would use that word again. If you're growing up children, the new generation is emotionally immunized, they will be able to deliver their work or message or interactions in a healthy way, mentally healthy style.
Yes.
So these are the platform on which I do my work, my everyday work.
Really important all these factors are, and also really interesting also to understand like how these small things can create an impact on not only your life but people around you. That is really an game changer. If you understand these things, definitely you not only would help yourself but the people around you to have a healthy life, as well as like work life balance could also be achieved through these things. And like most important thing is, if your mental health is better, your normal health would also be better, and you would be like able to concentrate on whatever things in place, whatever you are working, so personally, professionally, both.
That's right.
So right, sir, so if I ask you like what are some of the common misconceptions or myths surrounding addiction, and how we can understand the true nature of addiction, which can help individuals and their loved ones seeking recovery?
The misconceptions, going to the misconceptions of addiction, basically the general community don't believe that there is a abnormal entity or a disease entity or a troubleshooting the thing called addiction. It is actually, the beginning is a pleasure-seeking behavior.
Yes.
It is a pleasure-seeking behavior, and the misconceptions is that occasional involvement, occasional use, in a controlled use, and in a controlled involvement, maybe gambling or prostitution or sexual matters or alcohol, marijuana, all these are gives pleasure, and these are the basic misconceptions in the society. They prefer it to gain happiness, to feel comfort. They go to the pleasure-seeking behavior.
Right.
And the pleasure with the pleasure-seeking behavior, that is a gradually worsening condition. Following a regular or irregular use or involvement of the psychoactive substances or behavior, whatever it is. It alters the level of consciousness, the cognitive powers, the ability of perception, behavior, and all psychosocial functioning of the individual. Irrespective, it is alcohol, marijuana, gambling, or whatever it is. It's all basically the alcohol, and the other chemical is called chemical addiction, and the other one is the behavior addiction. Whatever it is, ultimately the individual is aiming at the pleasure, and when the reward system, there is a system in the brain called a reward system. When the reward system becomes active, every time the individual wants the pleasure. So this is the physiology of addiction. The brain, it is a structural and functional changes is taking place in the brain. Once the brain functioning is abnormal, the normal endorphin secretions, that is a pleasure-giving hormone. Normal endorphin secretions in the brain is reduced, and the artificial stimulant is required to produce the endorphins or other neurotransmitters like dopamine, norepinephrine, etc. So these are all chemical theories. And when the individual wants pleasures, he go for it. So the question is, can he control the pleasure-seeking behavior by himself? Majority is unable to do it.
Correct.
In majority of the people, pleasure is something like, accumulating interest in the bank. It goes on increasing. It's a happy event. So everyone wants more and more pleasure. But when you depend on this behavior addictions or on the chemical addictions, your reward system becomes altered and the endorphin secretion is reduced and you want it more and more. And there will be, that is called the tolerance effect. You want to get the pleasure, you want that behavior or you want the chemical more quantity or on more occasions. This is the tolerance. And suppose if somebody asks you to stop it, you feel withdrawal reactions. You are unable to cope up with the situation where the pleasure stimulations are not given. So these are withdrawal reactions. So to prevent a withdrawal reaction, the individual continues to behave or continues to use the chemical in that way with which he continues to get the pleasure. This is actually the addiction.
Right.
And recovery from addiction is not an easy thing. It involves maybe 6 steps. The first step is to identify an addicted individual. It is not a medical diagnosis. Somebody else is diagnosing that so and so using excessive marijuana, he is behaving abnormally. Then he is brought to the medical personnel. So somebody must be there to identify the individual who has the traits of pleasure-seeking behavior, which is slowly going into addiction. And second stage and the continued stage is motivate an individual for a recovery or for a control. Control is again impossible or next to impossible.
Correct.
So how do we motivate him? This requires a long-term counseling sessions and to help him to prevent withdrawal reactions. We may have to give him medicines to stabilize his sleep, to control the withdrawal reactions. This is a big job. Once it is done, then probably we may have to, third stage is to detoxify him. His whole brain and blood is filled with the alcohol, marijuana, or his brain circuit is altered permanently due to gambling or with the sexual behavior, the pleasure pattern, the reward is being permanently changed.
Yes.
So those things, the withdrawal reactions will be there. So detoxify him, make him more calm and quiet with the help of medicines, and a regular supportive counseling is required. Once he is detoxified and once he is calm and quiet out of his withdrawal reactions, then I would like to stop all the medications, but continue with the psychotherapeutic interventions and counseling programs, both individually, with the family, and in the group also. So the social support system is required for a complete recovery of the addicted person. Here it is important, the other thing, in 6 factors I told you to improve the society. So the involvement of the family members and the society is essential for the recovery of the individual. So this group session, I have a regular group sessions for the recovered addicts. Separate groups for alcohol dependence, separate group for sex addiction, separate group for marijuana. All these are separate groups, small groups. Their family members will also come. They will have to continue to motivate him to be away from this behavior, because the addictive behavior is repetitive.
Yes.
It has a compulsive element. It is a pleasure. So Correct. There is a compulsive element. So the motivation has to continue for a pretty long time, and in some cases even lifelong. I have got individuals who are in the recovered stage but still continues to be in touch with me for the last 40 years and 45 years. It's not a simple thing. Their grandchildren are now adults, but still they
Right.
are in contact. They are
Yeah.
in contact with me.
Correct.
And the next is along with the continued counseling sessions and things like that, we have to train the individual to prevent a relapse. He will have his own theory, like occasional controlled use is harmless. Occasional masturbation is not harmless. So he will try for it. And once he try for it, his cycle will repeat and he will go into again the addiction. So continued supporting system and train the individual to prevent the relapse. And the last and the sixth item is change in the lifestyle of the individual. I can't do it, he himself has to do it. So if he is adequately motivated, he is properly detoxified, and if there is a sufficient involvement of the relatives or at least the family members, there may be individuals who don't have a family, but he will have friends or neighbors. So the involvement of the society and how far the therapist has trained the individual to prevent a relapse. So identify, motivate, detoxify, involvement of a social network, train to prevent the relapses and to have a lifestyle change in the individuals. These are the 6 steps through which you can help an individual with addiction.
Right.
This is theoretically it is easy for me and you to talk, but when it comes to the practical level, this is really a very hectic work. A plastic surgeon can finish his surgery in 3 sittings in 12 hours or 20 hours. But when it comes to a mental health professional with regard to dealing with a case of addiction, it takes decades. He may go into relapse, he will have to be contacted again, he will have to be brought back, and in between sometimes short hospitalization. I don't believe in long hospitalization. When the withdrawal reactions is so severe, when that has to be controlled with the medications, I may prefer a short-term hospitalization. Otherwise, no, I don't prefer hospitalization.
Right.
So these are the steps through which I work on the cases of addiction.
Right, sir. You pointed out very well. You have explained the procedure to curing a person with any kind of addiction. But onto this, if I ask you, like, what are the different type of addictions, and how do these differ in terms of addiction impact individuals and their treatment journey can have?
Now, there are 2 types of addiction. One is the chemical addiction, which all the people know. Alcohol, opium, inhalants, stimulants, marijuana, etc. Those are the chemical addiction. Then comes the behavioral addictions. Behavioral addictions is sex addiction. Some people are addicted to masturbation. Some people are addicted in having multiple sexual relations with multiple persons, both in males and females. They enjoy it. They get addicted to it. They cannot lead a monogamy and a intimate family life. So this is what is called the sex addiction. Sex addiction also have got withdrawal reactions, and they resist for the treatment. They go into relapses. Everything is same as the alcohol dependence. Then what was the last part you asked?
So on to the treatment level, like how individuals in these addictions behave, or what are the patterns like they can use?
Yeah. Their behavior abnormalities. I told you sometime in the beginning, time is the most important thing in the world.
Right.
For every human. So these addicted people, it is called a dependence. The other word is dependence. Once they are dependent on some behavior for their pleasure, they lose the time. They are unable to perform their duties or tasks in the office or home, whatever it is. So the interpersonal relations go strange. They lose the time. They are unable to concentrate in their routine works. They prefer to go for the addictive behavior or chemical addictions. So the cooperation of the individual is required, which may not be there in the initial stage.
Right.
But as the relatives and the social network and the therapists join and able to motivate the individual for a recovery. If it is in the early stage, it is easy. If it is in the moderately severe stage, again it is difficult. And in the last part, in severe state, we may even need the help and support of the law enforcement people, because these addicted people become violent and aggressive during the withdrawal reactions.
Right. So really, need to be taken care of on which stage the person is. On the basis of that, the treatment or support should be
Yes.
provided.
Yes. The whole thing which I said, the progress of the humanity, the well-being of the humanity is based on the mental health. And again, the mental health is based on the rooted in the behavior, thinking, and living pattern of the individual. That part is being damaged. One of the major things is addictions.
Like addiction is the outcome of any of these problems.
Yes.
So, sir, as an psychiatrist, what approach or interventions do you find most effective in helping these individuals to overcome addiction, and how important is it to holistic approach that considers physical, psychological, and social aspect in addiction recovery?
In addiction recovery, the whole of the society has to cooperate, or the possible segment of the society has to cooperate. The administration, the law enforcing agency has to cooperate. The other medical specialties has to cooperate. So a cooperation of the different areas in the society, different parts of the governing mechanism, if these all join together, for example, the doctor, the police, the judiciary, the religion, the family members, if the whole can be mobilized as a whole, the community will improve. In individual causes, in individual cases, during the therapy period, we try to gather the cooperation of all these individual sectors.
Right. So, sir, now coming back to you again, if I ask your views, your thoughts about success, what is your take on this?
In managing the cases of addiction, in my long-term follow-up, I see about 60%, 55 to 60% of success. 40% I have to agree, definitely a failure. I call it malignant addiction. It is something equal to cancer. It is something equal to malignancy, which is growing day by day. 40% is failure, and you can say 60% is success. But the success is again depending on the other factors, the social factors, the legal factors, the administrative factors. All these factors has to combine together.
Right. So, sir, we are on last question. Any message or
Yes.
advice you would like to share with our viewers and listeners?
My advice would be three things. If you want to have a progressing, comfortable society, you need to do the emotional immunization from the childhood and adolescence, so that you will have a healthy community, society members. The second would be the pleasure-seeking behavior is everywhere. It is not abnormal. But we have to set a limitation depending on how the society is functioning and
Right.
what is our relation with our society. So we have to be a member in the society, we have to contribute to the society, and we have to take support from the society. This would be the second thing. And third is multiple models are there in the country. Multiple models, the political model, the religious model, the legal model, the medical model. All these models are, even though aiming at the same thing, it is not functioning jointly. The joint functioning of all these things can do better, and that will be helpful for the whole community and society.
Right, sir. This is really important that every aspect of society should contribute towards the success of overall society experience.
Yes.
Because
Yes,
what
yes,
happens
right.
is, if somebody is missing out, then definitely the impact would be on society itself, like everybody.
Yes.
Right, sir. And I must say, sir, the discussion with you was really amazing. And you have shared so many wonderful examples. You have shared so many realistic approaches towards better life. not only in terms of like addiction, but generally also. You have shared so many concepts and thoughts that was really wonderful, and I really find it really interesting that emotional immunization and participatory diagnosis can really impact heavily on all individuals, and especially if we can like introduce something of this sort to the colleges, and we can aware them about these concepts, how they can be mentally more safe, more secure, more balanced. Then definitely once they get into the work role, or they come for job, business, whatever activities, the impact of the outside world would not be much, because they would be balanced in their own selves. So that can create an impact.
That good. I would suggest you organize small group sessions. I can also participate.
Yes, sir. This is a really important thing. If we can do this at a college level or school level,
Yes.
not necessarily a course, but can be a session, few sessions onto
Yes,
this,
yes.
so they can understand things like what is the impact of right approach of emotional balancing, like emotional immunization, which you rightly pointed out. So that can create impact on their life. So they would be ready for the outside world.
Okay.
So that is wonderful, sir. I must say I really enjoyed the conversation, and the concepts you have shared was really amazing. And I'm looking forward to hear more from you soon again, maybe on different topic. And I must thank you for your time and your energy. You have shared so wonderfully and explained so wonderfully. Even if a person who is not from medical background, does not have any sort of that knowledge, would be able to understand this easily.
Thank you.
Thank you so much, sir. And
Thank
also,
you,
I
sir.
will share your social media link or website link so that people can be in touch with you, take your help and
Okay.
guidance wherever they are finding any kind of difficulties related to mental health or addiction. So they can
Okay.
take your help and guidance there. So guys, don't forget to check that out too. And finally, thank you so very much everyone for watching and listening. I hope you all must have gathered a lot of information and enjoyed watching it. Don't forget to like, share and subscribe. Have a good time. Thank you and bye-bye.